Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor, and your host.
Hi, my name is Victoria Russo. I'm a current second-year genetic counseling student at Sarah Lawrence College, graduating in spring of 2026, and I'm playing Kylie, the patient in this session.
Hi, my name is Brittany Gancarz. I'm a lead prenatal genetic counselor, and I'm playing a prenatal genetic counselor in this session. I graduated from Sarah Lawrence in 2012.
Today's episode is a mock prenatal genetic counseling session. We're recording in person, and so you're free to watch on video streaming platforms like YouTube or DNAtoday.com.
Hi, Kylie. My name is Brittany Gancarz. I'm the prenatal genetic counselor. I understand your OB referred you here today.
Yes.
So I did have the chance to review the referral for you. So I've looked at your ultrasound report and know why you're here. But why don't you start by telling me in your own words what you've heard so far, just so that we can start on the same page.
Yeah, awesome. It's really nice to meet you. So yeah, just to tell you a little bit I think I'm here. I went for an ultrasound about 2 days ago. I'm 13 weeks pregnant, and my OB said something about a lot of fluid in a certain spot, a high NT. I don't really know what that means, but they referred me here. So I'm just kind of here. I don't know much about genetic counseling, so.
Okay. So we'll unpack that ultrasound finding today. The idea with genetic counseling is that genetic counselors are here to help you understand chances for genetic conditions in your pregnancy and the different options for screening and testing.
Okay.
So we'll go through those things today and help you learn a little bit more about that ultrasound finding.
Okay.
I'll also be talking to you about a few different options for genetic testing, and it's entirely your decision in terms of what we do next.
Okay.
So my job is to lay out those options for you, help you see what's good about them, where they have limitations, and then we'll make a plan together as we go through our session today. To start out with, how has your pregnancy been going so far?
Pregnancy's been going great. It's my first pregnancy, so I don't really have many expectations, but everything's been fine and normal. A little bit of motion sickness, but other than that, everything's been good. So
okay. I'm glad to hear you've been feeling well overall.
Yeah.
So to tell you a little bit about that ultrasound they did at the office.
Okay, yeah.
Did they tell you much about sort of why they look at the fluid area, or did they leave that to me, which is also fine?
Yeah, they left that to you. I'm not really sure.
At this part in pregnancy, so sort of the end of your first trimester, all babies have a space of fluid at the back of their neck.
Okay.
It's called the Nuchal Translucency, or the NT.
Okay.
So that's why we sometimes call that ultrasound the NT ultrasound. At the time of the ultrasound, your baby is pretty small, probably about like yay big. So we can't see much of their body at that point, but that NT or nuchal translucency is something that we can look at.
Okay.
So why we look at that fluid-filled space is that all babies have a little bit of fluid collected under the skin there. For many babies, that space is thin. It's between, say, like 1 and maybe 3 millimeters.
Okay, wow.
If we do see that there's extra fluid back there, it does change the chances for certain things like genetic conditions or concerns for the baby.
I see.
So we measure that space to see how wide it is, see that it's wider than expected, then it raises the chance for these conditions, which I'll talk to you about today. But one thing that it doesn't mean there's something definitely going on. So I know that can be scary to hear that there's increased risks or chances, but we don't know at this point that something's definitely happening. We just want to unpack what some of those chances are with you.
Okay, that makes sense.
Okay. Initial questions so far?
No, I don't think so. That sounds pretty straightforward. So yeah, I'm happy to be here and talk about it a little bit.
Okay. So when we see that bigger space at the back of the neck, one of the things that we think about is the chance for chromosome condition.
Okay.
So these are genetic conditions. They can occur in anyone's pregnancy, and they impact our chromosomes, or the packages of genetic information. When we see that larger space at the back of the neck, it makes a chromosome condition a little bit more likely.
I see.
Now, did you ever take like intro biology or like learn about chromosomes at any point?
Yeah, I definitely like that word. Sounds familiar, but it's been a while, probably not since high school. So
okay. So I'm going to show you a picture just to help
awesome.
make clear what I'm talking about. But this would be a typical set of chromosomes under the microscope. So in real life, they're not in this nice organized fashion. They're sort of thrown in there. But then someone smart can organize them into a picture like this. And this would be a typical set of chromosomes. So as humans in general, we have 46 chromosomes. They come in these 23 pairs because we get one of each pair from mom and one of each pair from dad.
Gotcha.
The sorts of conditions we think about when we see an enlarged NT are mostly conditions caused by an extra or missing chromosome.
Okay.
So some of the more common things would be conditions like Down syndrome, where there's an extra copy of a chromosome, specifically chromosome 21.
Got it.
So for someone with Down syndrome, their chromosomes would look like this. They'd have 3 copies.
Oh, they have the 3. Okay.
Instead of just 2. And there are a few other conditions that we think of as some of the more common chromosome conditions caused by extra copies of chromosomes.
Okay.
So when we see that enlarged space at the back of the neck, one of the things we want to talk to you about is the option to do testing for chromosome condition.
I see.
We have a few different ways that we could go about that testing.
Okay.
And those options include tests called screening tests, also diagnostic tests. Kylie, you haven't had any testing so far in the pregnancy?
I have not, yeah.
Anything like that. Okay, great. So I'm going to talk to you about the options for different tests and, what they can tell you, where their limitations are. Sometimes talking about these enlarged spaces at the back of the neck, it can seem like we have a lot to talk about.
Right.
So I know it can get a little overwhelming, but definitely stop me if you have questions or have any concerns.
Okay, I will.
So the option for screening would be to do non-invasive testing. So that's testing that's, like I said, non-invasive. So we're mostly thinking blood work, and that can give us risks and chances for chromosome condition.
Okay.
So what we think of with that non-invasive option is testing called NIPT or non-invasive prenatal testing.
Okay. I think I've heard of that before.
You might have heard of that.
Yeah.
Probably its most famous feature is that people tend to hear about it as the test that can tell you the sex of the baby.
I see. Yeah.
It is one of its tricks. Its main goal is to screen for some of the most common chromosome conditions.
Okay.
How it goes about doing that is that it's done through a blood draw on you.
Okay.
And it's looking for small pieces of genetic information or DNA that have come from your placenta and are now in your bloodstream. We're looking at genetic information from the pregnancy, but non-invasively, just doing a blood draw from you.
Okay.
And then using that to screen for the most common chromosome conditions.
Okay.
So that's one of its limitations is it is focused on the most common things. It doesn't look at all of the chromosomes.
Got it.
2 of the other conditions this testing looks for are called trisomy 18 and trisomy 13.
Okay.
So those would be extra copies of chromosomes 18 and 13. Those are more rare than Down syndrome. Have you heard of those before?
No, I don't think so.
Okay, many people haven't.
Okay.
They are more rare, but they're also more serious than Down syndrome is.
Okay.
So when a baby does have either one of those conditions, their life expectancy tends to be short, usually a few days or a few weeks.
Oh, wow. Okay.
So they are quite sad conditions, unfortunately. The other thing that blood work looks at is the sex chromosomes X and Y. That's how it tells the sex of the baby when people want that.
Got it.
And it looks both at the sex chromosomes themselves, so whether there's 2 X's, which is what we expect to see for female chromosomes, or if there's an X and a Y, which is what we would expect to see for male chromosomes.
Okay.
But then another important thing that it does is looks to see if there's any extra or missing copies of those sex chromosomes. And when it comes to those enlarged spaces at the back of the neck, one of those conditions we think of is one called Turner syndrome. That's a condition that can happen when someone's missing a second sex chromosome.
Oh, so they have one less.
One less, right?
Okay.
So they only have one sex chromosome, and that would be an X chromosome. So
I see.
People with Turner syndrome have just one sex chromosome. It's an X. Therefore, Turner syndrome is a condition that generally affects females since they don't have that Y chromosome.
Got it.
And one other condition that our cell-free DNA looks at is a condition called 2q11.2 deletion syndrome.
Okay.
That's a small missing piece of one of these chromosome 22s. And it can cause some concerns like heart defects and cleft lip and palate.
Okay.
So with that blood test, it screens for that group of conditions. It doesn't look at the other chromosomes, so it wouldn't pick up more rare chromosome conditions.
I see.
Most of the time, if a baby with an enlarged NT does have a chromosome, most of the time it's one of the more common conditions.
Okay.
But sometimes it can be a more rare condition, and we wouldn't capture that with that blood test.
Okay. But if it were because of one of the more common conditions, that blood test would pick it up?
That blood test would very likely pick it up. So as a
Okay.
screening test, it can't give us definitive yes or no
Oh,
answers.
okay.
It is a good screening test. So it will pick up most babies who actually have those conditions. And it's very unlikely to tell us that something's going on if that's not really true. So it will pick up about 99% of babies who do have Down syndrome and trisomy 18 and 13. Accuracy can be a little different for those sex chromosome conditions, but it is very good as a screening test. Since it's not definitive or diagnostic, it's not for sure. It's not 100%.
Got it. I understand. Yeah.
For those more diagnostic options, we'll talk about diagnostic testing.
Okay.
So the blood test is our most accurate test that's safe and non-invasive for pregnancy.
Gotcha.
So as you'll hear with those diagnostic tests, we do have to consider some risks in doing the test. But with the blood test, there's not any physical risks for the pregnancy.
Okay.
It's blood work on you, and the results take about a week, about 7 to 10 days to
Okay.
come back to us.
And I can get that done anytime during my pregnancy or?
Yes.
Okay.
Yep, you could get that done at any point.
Okay.
And when results come back, if they were low risk, we wouldn't be suspecting one of those conditions.
Okay.
There are more rare conditions, like I said, that can be associated with that increased risk in the
Right.
back of the neck. So we still wouldn't know about those. If it were high risk, we still generally recommend doing diagnostic testing to confirm that because it's not a diagnostic test.
Yeah, that makes sense.
And that's particularly important depending on how someone wants to use this information in their pregnancy.
Right.
So if someone did want to make any changes to their pregnancy management, like they wanted to pursue something like pregnancy termination, we would recommend having diagnostic testing and not only that screening testing.
Okay. That makes sense.
Any questions about that option for screening?
I don't think so. You explained it really well.
Yeah.
Yeah, and I think that sounds like probably what I would want to do as of right now, but I would obviously want to hear about the diagnostic testing as well.
Okay, great. And one other thing to say is that all of this testing, there's many sort of right ways to go through it.
Okay.
So people might start with screening and then go on to diagnostic testing.
Yeah.
They might change their mind about doing testing or not doing testing, and all of that is fine.
Okay.
There's many right ways to put this together, and there's definitely no one size fits all
Okay.
sort of formula for going through this process.
Right. Okay. That makes me feel better.
Okay. Yes. Lots of good ways to navigate testing.
Yeah, definitely.
So the other option for testing that people have for the chromosome conditions would be the diagnostic testing option.
Okay.
So these are tests that the good thing about them is that they give us more of those yes or no answers. So they're more accurate. They're also more comprehensive. They can look for more rare things.
Got it.
So that diagnostic testing would involve one of two different procedures. Those procedures are called CVS, or chorionic villus sampling, and amniocentesis.
Okay.
And the goal of those procedures is the same, and the testing we do with those procedures is the same as well. The goal is to get some cells from the pregnancy so that we can do genetic testing on them.
Got it.
What's different is the procedure itself and what timing in pregnancy that we do it. So CVS is an earlier procedure in pregnancy. Do it around the time in pregnancy you're at now. So if you did want CVS, it would be something we would need to coordinate in the next few days. Amniocentesis is a second trimester test. It's done after 16 weeks of pregnancy. So that one would be a few weeks out.
Okay.
With the CVS, what we're doing with the CVS is taking a small biopsy or piece of the placenta. So we typically do that by passing a thin needle through mom's abdomen and taking a piece of the placenta and then using the cells from that placenta to do genetic testing. Both the placenta and the baby came from that same fertilized egg. So we can use the placenta as kind of a spokesperson for the pregnancy.
Got it.
Because this is invasive, we are going into that environment where the baby is.
Right.
This is not, unfortunately, risk-free, and there is a risk for, namely, miscarriage or pregnancy loss. So that risk is not necessarily high, but it is a small risk for something very serious. So we know that people consider these options really carefully. We think that risk is probably about a 1 in 450 chance to have miscarriage after CVS.
Okay.
So much smaller than 1%, but like I said, still a small risk for
Still
a really
there,
serious
yeah.
outcome. This procedure is done under ultrasound guidance. So that's what this probe is in the picture. They
Gotcha.
are watching with the ultrasound the entire time they're doing the test. The procedure itself is a few minutes long, and it's done here in our maternal fetal medicine department in one of our ultrasound rooms. Amniocentesis, like I said, done a bit later. Also done under ultrasound guidance, also uses a thin needle through mom's abdomen. And with the amniocentesis, we're sampling a bit of the fluid that the baby is surrounded with.
Oh, okay.
So that fluid has baby cells in it. They've washed off in the fluid. They're from the skin, the urinary system, and the GI tract. So we can take a sample of that fluid and then test the cells from the baby for these genetic conditions.
Interesting.
Amniocentesis, we think the risk for miscarriage or loss is slightly lower, more like a 1 in 900 chance compared to 1 in 450.
Okay.
There's a few more sort of like small subtle points about each condition that we can talk about in more detail if that's an avenue you want to go down.
Yeah.
First, I'll tell you what kind of information we would get from those tests.
Okay.
So we would be looking at the chromosomes. Unlike the blood work, we'd be looking at all the chromosomes.
All
so
of
we
them,
would do
okay.
testing that looked at all 23 pairs of chromosomes. And we've looked at that picture already to look at the chromosomes. What we would get from the amniocentesis, though, actually is a bit different than this. It's not a picture under the microscope. It would be a test called a microarray.
Okay.
Which looks at the chromosomes in finer detail than we'd be able to appreciate from a picture like this. So it's looking for extra or missing chromosomes and also a small extra missing pieces of chromosomes. Those are things called deletions and duplications. So microarray is a really thorough look at the chromosomes. It's as thorough as we're able to be for chromosomes, but that's still not looking for, every genetic condition that there is. That is looking specifically for chromosome conditions.
Okay.
But chromosome conditions are the ones sort of most associated with a larger space at the back of the neck.
Okay.
Questions about that?
I don't think I have questions. I think this is sounding like a good option if I did the blood work and it did come back high risk, then maybe this is something I can pursue later in the future, depending on the results of that blood work, if that's something you think sounds appropriate.
I think that sounds really reasonable. One thing I realized I didn't talk to you about at this point, Kylie, is what that actual measurement was and what kind of risk it gives you for chromosome condition.
Okay.
So like I mentioned, most of the time, those spaces at the back of the neck are between 1 and 3 millimeters.
Okay.
So we are talking about little spaces here.
Yeah.
Right? When the measurement is over 3, then we think that that's generally where we get those increased risks. So your baby's measurement was 3.7. So it is over that 3 mark. And I just want to show an image of what that space actually looks like.
Okay, yeah.
I like this image because it shows both the ultrasound perspective and then sort of the cartoon baby to see what we're talking about here.
Oh.
So this would be a typical NT measurement. So you can see that NT itself is that thin black space.
Oh, okay.
And then they've placed that green marker here to show how wide it is. So that one would be within the normal range. And then this one we can see it almost looks like
bigger,
it's
yeah.
Out, right? So that 3.7 is definitely what we'd call increased. But like I said, we still don't know that something's actually going on. A reference I use when we see these enlarged spaces sort of breaks down by size what the chance is for chromosome conditions, because that chance does change based on that NT measurement itself.
Okay.
So if your NT had been much larger, like say we were here talking about an NT of 6, we'd be talking about really different risks than we're talking about today. Let me just find that here. For that 3.7 measurement, we would think that gives about a 20% chance for a chromosome condition. So we could look at that a few different ways. We could say that's a 20% chance or a 1 in 5 chance. We could also look at it from the other side and say that's about an 80% chance your baby does not have a chromosome condition.
That feels a lot better.
Right?
Yeah.
One time I had someone tell me those were not the same thing, and I was like, they are, though.
No, it is,
They are, right? But these chances can seem really different if we look at them from different perspectives. There are a few other concerns that we consider with an enlarged NT in addition to chromosome conditions.
Yeah.
Some of those are genetic and some of them not so much.
Okay.
One of the concerns that can be not a genetic thing per se is the chance for something like a heart defect. So we've seen that sometimes an enlarged space at the back of the neck doesn't mean a chromosome condition, but can mean a change to the shape or structure of the baby's heart.
Okay.
So for that reason, when we see these larger spaces, we typically do some additional ultrasounds to get a good look at the baby's heart.
Okay.
And we can also see other birth defects where the nuchal translucency is sort of the first sign. So we also do some detailed anatomy scans as well. So in total, we'll probably do at least 3 more ultrasounds to just look look closely at the baby's body. In general, those are going to be around 16 weeks for an early anatomy scan, around 20 weeks for a full anatomy scan, and then around 22 weeks, we do something called a fetal echo. That feels like a normal ultrasound, but it's looking specifically at the baby's
Oh,
heart.
wow. Okay.
That heart is, of course, a really small and complicated structure, so we can generally see it best around 22 weeks of pregnancy. That can also mean that this enlarged NT can seem like something that keeps going on and on.
Yeah.
It does take quite a while in the pregnancy to gather all the information, and I understand that that's really hard, right?
Yeah.
You're sort of waiting for that next milestone.
Right.
And then finally, one other genetic consideration when we see the enlarged NTs would be a genetic condition called Noonan syndrome.
Okay.
That is a condition that can cause some concerns like heart defects and some intellectual disability that can manifest with the NT as the first sign. So that's another condition where if we were to do diagnostic testing, we could coordinate testing for that. We do have some screening available for Noonan syndrome. There is a blood test that can look at a group of genetic conditions that includes Noonan syndrome. Like all the cell-free DNA testing, it's not considered definitive or diagnostic. It is a screening test. But that would be an option as well.
But if I got the amniocentesis, is that how you said it? In a few weeks, it could then test for the Noonan syndrome?
Yeah.
Okay.
Yeah.
Got it.
One approach that some people take is they might do the screening that we can do we could do that screening today for you. And they might do the screening and use the results of that screening to determine whether they wanted any diagnostic testing.
Yeah.
They could also do the same with future ultrasounds. So they could gather the information from their ultrasounds and say, based on that, it might sway how I feel about the diagnostic testing. If that ultrasound information looked reassuring, then maybe I'd lean away from doing something invasive. If other concerns came up on ultrasound, then I might lean into that diagnostic testing option.
Yeah, I think that sounds like a good path for myself so far, based on everything you've said.
Okay, so maybe to start with some screening and the ultrasounds and see how those go.
Yeah.
And with the screening, sometimes people feel differently. When we get the blood test results, if they showed a high risk, then like you said, many people would say, okay, I might follow this up with some diagnostic testing to see if that's really the case for the pregnancy. If the results of the screening are negative, people may also consider the diagnostic testing to look for those more risk things too.
Yeah.
So whether the screening results are low risk or high risk, that diagnostic testing still
can still happen. Okay, that sounds good.
Also, if anyone wanted diagnostic testing, they could have it. You know, they wouldn't need to have any sort of certain screening results. It would always be available.
Okay, so either way, however the screening test comes out, I can still get the diagnostic testing. Okay, that's good. Good to know.
A few questions for you. How are you feeling about all this at this point? I know I've given you a lot of information.
It's definitely a lot of info, but you explained it really well. And I feel like I was able to follow along. Definitely overwhelming, but I'm happy to be here and I'd rather be safe than sorry. So I think feeling good about what you've shared and the 80% risk, that sounds better to me than the 20%. So I think I'm feeling okay to follow through with the screening and then talk about diagnostic testing if need be as time goes on.
That sounds like a good plan. Let me ask you a few questions about family history while you're here just to make sure we're not overlooking anything.
Okay, yeah.
And then I will just give you a few finer details about your screening. We'll set that up for you today.
Yeah. Okay,
and then
great.
We will make a plan for when those results come back.
Okay, awesome. And will you call me with those results or will we meet again?
Yes. So I'll be the person who calls you with those results.
Okay.
They will... Cell-free DNA screening for the chromosome conditions takes about a week, about 7 to 10 days to come back. So I'll reach out to you when we have that result.
Great.
And then if you wanted to do that cell-free DNA testing for those conditions such as Noonan syndrome, I will tell you a few more things about that when we're setting up that testing. But that takes a little bit longer. It takes more like 2 weeks.
That's fine.
I'll reach out to you. And then why don't we touch base again when you come back for that 16-week ultrasound cell-free DNA results, and we'll see how you're feeling at that point and about whether you want to go forward with any other testing.
Perfect. That sounds like a good plan. Thank you.
So you had mentioned, Kylie, that this is your first pregnancy.
It is.
I'm just going to draw a family tree.
Cool.
In genetics, we draw these family trees. The long and short of them are that the males are squares, the females are circles.
Okay.
And your pregnancy gets to be a diamond because we don't quite know yet.
Yeah.
And you mentioned this is your first pregnancy. For the father of the baby, is he your boyfriend, your husband? Is he someone you're in a relationship with?
My husband, yeah.
Your husband,
Mhm.
okay. Is this his first child as well?
Yes, it is.
And what's his name?
Tim.
Tim. Okay, great. And then if you think about your and Tim's families, and you can think about siblings, parents, aunts, uncles, cousins, nieces, nephews, anyone with any intellectual disability or problems learning.
Tim's sister has a son with autism. Other than that, I can't think of anyone else with any intellectual disabilities. He only has one sister, and that's her only child. Is her son. He's 4.
He's 4, okay. And where would you put him in terms of severity with his autism? Would you say he's mildly affected, severely, or somewhere in the middle?
It's mild from what I've heard, yeah.
Do you know if any genetic testing has happened for him?
Not that I know of.
So when it comes to autism, you probably know that in terms of what causes it, we have more questions than we have answers.
Yeah.
There's a lot of things that are speculated about the cause of autism, and most of those things are not supported by evidence, right? Like, for example, we don't think things like Tylenol cause autism.
Yeah.
If we look big picture at people with autism, about 1 in 5 of them have a genetic diagnosis that can help explain why they have autism.
Okay.
That does tend to be more toward the like moderate, severe population of people with autism. So anyone with autism is considered a candidate for genetic testing. So if Tim's sister were ever interested in genetic testing for her son, she could definitely connect with like a medical genetics group to get that done for him. But looking at this being a first cousin to the pregnancy, one other question, anyone in Tim's more extended family with autism?
Nope.
Just him, okay.
Yeah, just him.
With it being a first cousin to your future children and just one person, very unlikely to raise risks for your kids to have autism beyond the general population risk, which right now is about 1 to 2%.
Okay, that makes sense.
Anyone in either family who was born with any birth defects or needed surgery as babies?
No.
Anyone with problems in pregnancy, like 3 or more miscarriages? Any babies who died around birth?
Nope.
Anyone with any physical limitations like muscular dystrophy or they've needed to be in a wheelchair from a young age? Anyone with anything you think might be genetic or passed through the family or that you have questions about?
I know I myself have factor V Leiden.
Okay.
I know I got that through my dad's side of the family. My uncle, so my dad's brother, had pulmonary embolisms. And then he got tested for, I guess, blood clotting genes. And that came back positive. And so then my dad also got testing. He also had it. And then me and my sister both got testing as well. And we both have it as well.
Wow. Okay. So your uncle's pulmonary embolisms kind of started that cascade.
Exactly.
Yeah. In your family?
So yeah, he was in his 40s, early 40s when that happened, got treatment. And then that's what kind of sparked the testing. So yeah, I've heard about genetic testing in that regard, but haven't heard about it too much before having a baby setting. So yeah.
So as they probably walked you through at the time, people with the factor V Leiden have an increased risk for clotting.
Right.
But most people with factor V Leiden will not have blood clots in their life. So it is a risk factor, but not a definite thing.
Yeah.
Are you on any like prevention because of that? Like, do you take like a blood thinner like the Lovenox?
Yeah. So once I found out I was pregnant, my OB kind of recommended I take a blood thinner just because my uncle did have the blood clots. And I know I have the gene.
When you meet with maternal fetal medicine, you'll definitely talk to them about that.
Okay.
And they can give you any thoughts or recommendations about that. The only thing in terms of this genetic testing, so the factor V Leiden is not generally something we think about like prenatal testing for because it is only a risk factor and it's more in the realm of adult onset things. The only thing to consider is that sometimes for that screening option, the cell-free DNA testing,
the blood test,
there are kind of 4 different results that we can get from that. So we've mentioned what a negative result would mean. We've mentioned what a positive result would mean. One other thing that can happen with that blood test is sometimes the test sort of fails on us. That can happen if there's not quite enough genetic information that's coming from the pregnancy to be able to get a reliable result.
Okay.
That's sort of an important quality measure for the testing is let's make sure we're seeing sort of enough of pregnancy genetic information and not just looking at mom's genetic information, which is what we're after. Use of blood thinners like the Lovenox can lower that amount of genetic information. So it makes it a little more likely to get sort of a like failed cell-free DNA test.
But then I can do it again?
We would usually repeat it. Yeah.
Okay.
You are also already 13 weeks. We'd be a little more concerned about that if you were more like 9 to 10 weeks.
Okay.
So I don't think that's going to be a problem. But just to let you know, if we do end up with a result like that, it could be that.
And don't be frightened or anything. Okay. That makes sense.
So you'll speak about that with them. We see that. And then in terms of if we think of chances for your children, they would have a 50-50 chance to inherit that.
That makes sense. Yeah.
Factor 5 lied in from you. I should have asked, it is true for most people, but did they say you had one genetic change for factor 5?
Yeah. What you said heterozygous before. Yes. That rings a bell.
Okay. So you have that in the family. Any other concerns for genetic things?
No, not that I know of. Yeah.
Okay, great. So there's no, big red flags jumping out at me from your family history.
Okay.
Although when we consider the things we're thinking about with the enlarged NT, there's usually not.
Okay.
So family history is definitely an important tool, but we wouldn't use that to change any of the recommended testing.
Got it.
One more question for you, Kylie. Do you know if you've ever done some genetic screening that's called carrier screening?
Yeah, carrier screening. I know Tim and I did that before we got married. We got that done.
Okay.
Yeah.
Did they kind of describe it as we're going to see if you're a carrier for genetic conditions, and then if it is both of you, there might be a chance for the pregnancy to have it?
Yeah, we got tested for a bunch of things, so it was a long report. But yeah, I know we had gotten that done already, and they explained it. So
okay, great. So it was a pretty a robust list of conditions.
Yeah, it was extensive.
Probably more genetic conditions than you knew existed.
Yeah.
Just to give you some background on what that is.
Okay.
That's genetic screening. It would be made available to everyone. I'm glad it was made available to you before you got married. That's great to hear. And it's looking to see if people are what we call carriers of different genetic conditions. For the most part, those are conditions where it takes both mom and dad being carriers of the same thing to be at risk to have a child with that condition. So as long as they're not carriers of the same thing, we're reassured.
Yeah.
And then there are a handful of conditions on those panels that just take mom to be a carrier. Nothing high risk or concerning came back from that?
No. Yeah, it all came back normal that I'm concerned with, so.
Perfect. Okay, great. That's also a test that's kind of a once-in-a-lifetime test.
Yeah.
So that looked at your own genetic information, which doesn't change.
It won't change, okay.
Before pregnancy, we don't need to repeat that.
Okay, good. Yeah.
So our plan today will set up screening for you. So we're going to do that cell-free DNA testing for chromosome conditions. So to remind you, it's going to look at the risk for Down syndrome, trisomy 18 and 13. It'll look at those sex chromosomes X and Y.
Yeah.
To see how many there are. I know we've given you lots to worry about, but are you planning on learning the sex of the baby?
Yeah. No, I'm open to it. Yeah.
Okay, so we can tell you about that as well. And then that 22q deletion syndrome. The 22q deletion syndrome isn't necessarily associated with those enlarged NTs, so it is still part of our screening test, but we're not thinking of necessarily a higher risk for that one.
Got it.
The other cell-free DNA test is using that same technology, so still just a blood test on you. They'll draw both of them at the same time. I'm looking for DNA from your pregnancy, and then looking for a total of about 30 conditions that are conditions that are caused usually by new genetic changes in the baby. So unlike the chromosome conditions, there are conditions that are caused by changes to single genes. So if we think about our genetic information like a set of encyclopedias, the chromosomes are looking at the number of books. These conditions are caused by changes to the text in those encyclopedias.
That makes sense.
So this screening looks for that group of conditions that are caused by changes to those genes. Noonan syndrome is the one we'd probably think about the most in association with that bigger space at the back of the neck.
Okay.
Noonan syndrome can be caused by a couple different genes, and it'll assess for those. And then also looks for a group of other conditions as well. Now, some of these don't have anything to do with an enlarged NT. It's just sort of the package you get when you do the screening.
Good to know.
Another group of conditions that can be associated with an enlarged NT are conditions that affect sort of the skeletal system. They're called skeletal dysplasias.
Okay.
They can also be thought of as different forms of dwarfism. This screening is not exhaustive by any means. It's not looking at every genetic condition there is, but it is looking at that group, some of which have that connection to the bigger space at the back of the neck.
So it screens for a good amount.
Screens for a good amount.
Okay.
Yeah. Again, neither one of these is considered diagnostic or definitive.
Right.
But they can be a non-invasive way for you to get an idea of if there's a condition going on.
Okay. That sounds good to me.
Okay, so we'll make that plan for the blood work. You can get your blood drawn for that today.
Okay.
And then you'll hear from me. I'll call you when each test is back. So
Okay.
you'll hear from me in about a week with the cell-free DNA for the chromosome conditions, and then probably in another week with the other cell-free DNA testing.
Okay.
If you think of any other questions in the meantime, you are welcome to call me or send me messages through the MyChart.
Amazing.
So feel free. I know I often think of questions like on the drive home. Like, what my questions would have been. So definitely feel free to reach out if you have questions, and then we'll plan to meet again before your 16-week ultrasound.
Okay, great.
Do you have any questions for me at this point, Kylie?
Not off the top of my head, but I really appreciate all the explanations. You were super helpful and reassuring too. I have a better understanding of everything now, so I really appreciate it.
All right, great. It was very nice to meet you today.
So good to meet you.
We'll be in touch.
Thank you so much. Thank you for watching. We hope you enjoyed our mock prenatal genetic counseling session. This is part of a broader series from DNA Today where we cover various specialties, so be sure to check those out as well. Thank you.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.